We are live. Well, welcome to the Talk at 10 with Dr. Miller and Nurse Jessica. And so today we are going to be talking about all kinds of autoimmune diseases, and not only the autoimmune diseases, but a common cause that is seen in all of these autoimmune diseases. And so in functional medicine, we talk about one disease, many causes, and one cause, many diseases. And this seems to be one of those root causes. So as you are coming into the video, please say hi. If you have any questions, I'm going to pop my email up that if you want to talk to me afterwards or send me a question privately, there's my email address, and I'll be happy to address those. But getting back to the issue at hand, which is one cause and many symptoms. So today we're going to talk about what is known as intestinal hyperpermeability, because this is one of those root cause things that we see in a lot of our functional medicine. Actually, we see in almost every one of our functional medicine patients. And clearing up just this one thing takes one big layer off of that onion to help the body begin to heal itself more effectively. Good morning, Kathy. You see Gracie's door because Jessica is at home and she is cleaning because we are putting the house back together after it's been destroyed forever. So where we are at right now is I'm going to share a slide here real quick. I'm going to add this to the stream. And what we're looking at is one of the companies that I work with called Cyrex, and I do a lot of testing with them. They talk about these the causes of this immune function. So if you look right here, we see immune function, we see mucosal barrier, and we see essential barrier testing and environmental triggers in testing and predictive antibodies and autoimmune reactivity. So what you're seeing there, let's simplify this for just a minute. And I'm going to take that off of the screen. Your gut is a tube that runs from your mouth all the way down to your anus, and it should be closed, much like you see right here. And so this tube, as you look at it, is sealed. And what happens when you get hit in the head, if you're eating a crappy diet, if you're stressed, if you do endurance training, so if you get what's called runner's gut, if you do endurance training, all of these things can lead to what is called intestinal hyperpermeability. And what that does is it takes that gut layer that is supposed to be protective for us. And so what happens when you do these things is the gut becomes holy, and things are allowed to go in and out of the gut that aren't supposed to be there. So macromolecules can go through this. And as we look at that, that's when we start to see things like this immune function start to go awry. Because when you have immune function going awry because you have macromolecules of food getting into the system, causing inflammation, exciting allergies and stuff like that, then all of a sudden you can start to have these autoimmune conditions. Because if your body cannot pull out if your body can't pull out the toxins, or keep if your gut can't stay sealed so the toxins pass through, then they get into the bloodstream, causing allergic reactions and inflammation. Then what can happen is called molecular mimicry. And so if your body looks at a molecule and it looks like something that is the thyroid, it will start to have an autoimmune reaction to the thyroid. So that's when we start to see Hashimoto's, and we see thyroiditis, hypothyroidism, and things like that. This also has been linked to diabetes type 1, diabetes type 2, obesity, metabolic syndrome, because your body is in a constant state of inflammation. And when that happens, the environmental triggers that happen to us, let's say you're being exposed to molds, pesticide, glyphosate, those things will get into the body and they start to break down the barrier. And then you can start to see reactions like, what do we search for when we're trying to test for this stuff? We are searching for IgG, IgM, IgA, these types of immune responses. And so that's when those antibodies start to become predictive. And that's why when we do testing, we look at thyroxine antibodies and thyroid antibodies, peroxidase, and stuff like that, because the thyroid is something that's actually, since it's very metabolically active, it gets attacked very easily. So as I come back over here and I get the screen large again, that's how this intestinal hyperpermeability can cause so many different issues, because genetically, how is your body going to respond to the assault or going to respond to the inflammation? It's just doing what it's supposed to do. Inflammation is actually a very normal thing. Even in the hospitals and stuff like that, even in the hospitals and things like that, they're starting to allow people to run a little bit of a fever, because if they allow people to run a little bit of a fever, they're training the immune system. They're training the body to fight things that come in that aren't supposed to be there. So that's how you can have one issue, one symptom, that intestinal hyperpermeability. And what we want to do is get in there now, and through using food, and if you're stressed, through using meditation and prayer, we want to seal that back off. Go for a walk in the woods, do all kinds of things to help calm yourself down. So then, why is that important? And think about this: your gut actually uses 40% of your energy per day. Your brain uses 20. So right there, 60% of your daily calories, your daily expenditure is now used up with just the gut operation and just the brain. So it's very important to go on into this and to make sure this is sealed up, because if you don't have this sealed up, and it's about the size of a tennis court. So if you take it and you open it up and you take all those little crypts and villi and you spread them out and you flatten them out, they then become they become about the size of a tennis court, and that's what's inside you. So you have to seal that up. Then once we do that, just trying to make sure I hit all my points, got them written up over here. Then once you do that, we have to really, really start to decrease the inflammation, because as you decrease the inflammation, if you have a leaky gut, there's more than a 6% chance that you have leaky brain. And so with the lupus, the MS, the Hashimoto's, the diabetes, the obesity, the metabolic syndrome, all of that stuff, the next thing you got to look for is, are you having signs and symptoms of dementia, Alzheimer's, and those things? Because if you have a leaky gut, you have a leaky brain. So you're probably starting to see that it all ties together. Your body doesn't segment things out. Your body doesn't compartmentalize the way that we consciously compartmentalize. So we have to really, really get into this and start to heal this up, look at this as a root cause of what causes people's autoimmune issues. And that's where we have to start to look for people we do testing. So when we start to do testing, hey, Jess, do you want to talk for a second? I'm going to grab a couple of slides here. I got this ability to now share slides, which is good. Why don't you talk about your experience with intestinal hyperpermeability and people that we know that when they pay attention to the things they eat and they pay attention to whatever else, how do they react?
Oh,
Well,
well,
I go to
I'll just
slides.
use myself as an example. So if I eat the way I'm supposed to eat because I have all kinds of food sensitivities, then I feel great. My stomach doesn't swell up, my joints don't hurt, I don't have headaches. I'm just going to put you over here. Um, my mother, who has autoimmune disorders, she gets sick to her stomach, she gets diarrhea, she has headaches, her back hurts, her joints hurt. But if you figure out what it is, well, one, if you seal your gut up and you do right by your gut, then your gut does good by you, and then you don't hurt, and then you feel better, so you do better. But I think you should learn to just listen to your body, because if you listen to your body and you figure out what the problem is, not just treat the symptoms, then you alleviate all the symptoms eventually.
All right. I found the slide. I've popped it up there. And so what we do is we start to look for those advanced IgG, IgA, IgM, and we look for lipopolysaccharides. And when we start to see these things in the bloodstream, some of the markers, there are a range. So there's a range of IgG, IgA, and IgM that is normal. So we have to look for these things and make sure they're not out of balance. And then if they're out of balance, which one's out of balance? Because if it's an IgG response, IgG responses are those insidious things that take 2 to 3 days to kind of show up. And that's how food sensitivities kind of react. So it's not a food allergy, it's a food sensitivity. And if your gut is not in good shape, then certain foods can cause certain issues, which give you problems. And that's an IgG response. IgM is when you've had an IgG for a long time, then you start to get these memory cells, and that takes a lot longer to take care of. Of course, the IgE, that's a true allergic reaction, EpiPen time, and start to do that. And then you see over here where we're talking about lipopolysaccharides. So these things are very insidious because they are a lipo, which is a fat. As we look at this next slide, your cells in your gut wall. So this is where we're looking at this, and that should be a tube. You're looking at that tube. They've taken a cross section of the tube. So we've cut this tube in half, and that's what we're looking at right here. And you've got this little brush border, and then you got this tight junction. And what happens is you can have paracellular leaky gut. So you have something that's coming in here, and you can think of that like gluten. So if you're getting little bits of gluten in your food, this is why some people who have celiac disease are sensitive to just particles of gluten in the air, because it breaks down this border. And that tight junction right there, when that's broken down, all of these food molecules can go through. And as they all dump in, what are they dumping into? What is this down here? Well, this down here is your bloodstream. And that's that person that sits here and drinks milk and starts to have the sniffles, and so as they start to do that, you know that they're having a reaction to this. The lipopolysaccharides, because this cell, the outer membrane, is made of fat, that lipopolysaccharide allows the thing to go right through the cell. And as it goes right through the cell, it pops right down into here, into the bloodstream. And so you can have a lipopolysaccharide, an LPS, going in and also causing autoimmune diseases. And that's where we have the issues with the thyroid. Hi, Vic. We have issues with the brain. We have issues with all of these other organs that, oh, you have IBS. Well, the IBS is because you're doing blah, blah, blah. Let's give you something to clear it out. You're having acid reflux. Let's give you the purple pill. So these things are the things that happen that we're covering this up. And the problem with that is if you're taking the purple pill to block acid, then you're not actually breaking these particles down and you're still allowing this to happen. You're just covering it up because the particles are still going to be there. And since the particles are still going to be there, they're still going to go down into the bloodstream. You're not going to have the acid reflux, but now you're going to have, you know, IBS. You're going to get, start to have gastrointestinal issues, diarrhea, constipation, flipping back and forth between diarrhea and constipation. These are the things that happen to us. And we really aren't aware because, there's no little sensor down there that says, hey, this is broken. We need to repair it. So that takes a while. And you've got to start to tune into that. I had some back pain today and I ate dry roasted macadamia nuts yesterday. And I ate a lot of them because it was a fasting day. And when I came off my fast, I ate the macadamia nuts. Well, guess what? They're in like a soybean oil or something like that. And so today I have back pain, and I bet you that it was because of that. And as I get back onto my normal diet, I have salmon back there and I have a salad and I'm going to make a green smoothie. As I get back onto that, I'll clear this out. I'm not going to get adjusted today. I might get adjusted tomorrow. When that happens, I should have the ability to clear this out. And I bet you my back pain goes away without having any issues or having to get adjusted. I know that's heresy as a chiropractor, but it's just the way we work. So then when you start to look at systemic lipopolysaccharides, look at everything that these hit. And right off the bat, you can see the one over here. So LPS, ooh, man, there's a delay on that. So LPS over here, right here, that's the thyroid gland. And it can go through what is called molecular mimicry and it can hit that. Typically, for me and my family, my genetics, we hit the brain. And so when we start to see the brain getting smacked down right here, then we start to get forgetfulness. It changes mood. It changes attitude. It changes all kinds of things. And so you can be attacking the liver. You can take your immune system and you can, if you have a great immune system, it's going to become really upregulated and you're going to have problems with the cytokine storm. You're going to have problems with histamines. You're going to have problems with all kinds of autoimmune issues that are hyperregulated. It'll attack the heart and give you issues there. And joint pain, that's where I'm going with my back pain because I haven't had back pain in forever. And so I think that it's going to be from that. I ate too many. I overate my nuts. And so then my joints hurt. And because I've wrecked my bicycle and hurt my back many times, that's the joint it goes to. The other thing that it does in my family, and it may be doing in your family or even in you, is the metabolic disorders. So that's the diabetes, and that is the syndrome X. So if your waist is larger than your hips and you're having issues with insulin and whatnot, those are all reasons. Because think about this, lipopolysaccharides will cause stress. Stress causes your body to release cortisol. Cortisol will raise blood sugar, which in turn raises insulin. So you have a beautiful little cascade that happens there. And those are the things that we just weren't told. I mean, I'm pretty sure that if I told you, I'm not even going to go as far as a Twinkie. Your whole wheat bread sandwich is causing you to intake gluten. It's not sprouted. It's used to hold it together. It's enriched. If it has artificial sweeteners in it, anything that has artificial sweeteners, I actually just learned this. I was listening to a pediatric neurologist talk. Your artificial sweeteners, one of the things that they use in conjunction to actually make the artificial sweeteners, mercury. So there are trace amounts of mercury in artificial sweeteners. So it's just unbelievable. And all of these things attack and damage the gut. So those endotoxins are gram-negative bacteria. And when gram-negative bacteria get into the body, you do have some when they get out of balance. It causes problems and lots of inflammation. I am going to find another slide here. So Miss Jessica. Uh-oh. She sounds like she's in the closet, deep in the closet.
No, I went to get a coat. What did you say? I'm sorry.
I am looking for another slide, so I'm going to have you please talk for a moment.
Tell me what you want me to talk about. I can talk about anything.
So I was talking about just a little bit ago, you heard me discuss the issue with taking something, I don't want to name a name brand, but taking something to lower fever. Why would you not want to do that?
Never to do that unless you have a really high fever. Because all you're doing is wiping out your immune system at the most native level. I mean, that's just what happens. So if you're constantly taking something to bring down a fever, you never allow your immune system to ramp up. So you actually never really get an immune response. So, I mean, you don't want to get a high fever like greater than 102.9, or you don't want to sustain a fever greater than 102.9, especially a child that's fragile, because it puts you at risk, especially children at risk of seizures. But you want your body. You just got a slight fever, or you have a fever that's 101.5, then let it run its course, because your immune system at some point is going to rev up and kick in, and your immune system gets stronger because of it.
All right. So as I come back to this, I'm going to share. So we can now look at the blood-brain barrier. And once again, the blood-brain barrier is very similar to the intestinal barrier. So if you have intestinal hyperpermeability, so your gut is leaky and it's allowing lipopolysaccharides to fall through and go through into the bloodstream, eventually that bloodstream that is going to get to, oops, got to get my pointer over here. That's going to get into the brain. So you have your tight junctions in the brain right here, and those tight junctions in the brain start to break down, and then you allow things into the brain that aren't supposed to be there. So this is when lipopolysaccharides, gluten, and things like that start to cause you to forget. Doorway syndrome. I walked into this room and I forgot what I came in here for. What in the world was that? And so that's part of that issue. That's how that starts to happen to you. That's how that starts to break us down from the inside out. And then if you have things getting into the brain, then you start to form antibodies to that. And so then you break things down. And so it's very, very important to make sure that your gut is intact, because if your gut is intact, then your brain will be intact. And if your brain's intact, then you can still think and help and save yourself, because you're the only person that's going to do that. So it's very interesting how, I mean, I forget which of the old guys said death begins in the gut. I think it was Hippocrates, the father of medicine. I think he said death begins in the gut. And so it's very true. Death does begin in the gut because when that starts to break down, that really starts to take apart your body from the inside out. And so here's another slide showing how E. coli, if it has that lipopolysaccharide film around it, it can go through the intestine or the transcellular pathway and get down into the bloodstream. And then once it gets into the bloodstream, it can start to attack your organs. When we start to have food antigens, think gluten, think high sugar diet, then you break this tight junction and you allow this to go down into the body and start to break down the body from the inside out. And it breaks down your gut, it breaks down your health, it breaks down your brain, it breaks down your thyroid, it breaks down your kidneys, it breaks down your liver, it breaks down everything. And that's why we look at the IgG, IgA, IgM, and we test for food sensitivities. But we don't test for food sensitivities first. Because if you're testing for food sensitivities first and you have a leaky gut, guess what? You're sensitive to everything because everything's getting through and it shouldn't be there. So your body mounts a defense against it. You have to then go through and you have to seal this up. You have to stop this from happening. You have to let this heal. And then as you let this heal, then the symptoms start to go down. Then you can do a food allergy test. And then you can start to see everything that you need to see to prevent yourself from getting into this situation again. I think you're up on the chair, huh? Don't hurt yourself. Don't fall.
Well, I too.
Jessica I said it earlier in the opening, that Jessica's home. She is arranging and cleaning and getting everything ready as we're putting the whole house back together. And I get to do wonderful things like this on the side while she's working. I get to goof off and play with slides and whatnot. So Cyrex has a very interesting slide here. And this is kind of showing how we have actually hybridized and made this a lot larger. They don't show the old one, but this gluten has been bred into our wheat so that it is more than 60% of the kernel anymore. And when you do that, it makes it highly reactive in us. And look at this. It's when you look at gluten proteins, we all think about gluten and we test for alpha gliadin, but you have alpha gliadin, you have deamidated gliadin, you have gliadin toxic peptides. I forget what that, is that Omicron? I forget what those two, but this gluten and this gluten, these two glutens. So that is a gluten family. That's why if you just test for alpha gliadin and you don't react to it, that's not truly a negative test because we are early into this science. It almost makes me afraid as to what we're going to find as we dig deeper. But with that being said, we now have all of this that we know of right now that can make you sensitive. And that's why we call it non-celiac gluten sensitivities. And then they've bred this wheat to really hit the opioid receptors. And so you have gluteomorphins and that one's a good one, or a new one for me. Prodinomorphin. Both of them break down into opioids. So when you eat a piece of bread, even though bread doesn't have a lot of taste unless they add high fructose corn syrup to it, which high fructose corn syrup is processed with mercury also. So that all, if it's a sweet tasting bread to you, then you know it probably has high fructose corn syrup in it. But just the wheat alone hits the gluteomorphins and produces your body's own endogenous opioids. And that's why you like it and you crave bread. Then we go down to the bottom and you see this, well, the non-gluten peptides, we're still learning about those in science. How do they affect the body? How do they get in there and change us? What do they do to us? And then you have wheat germ agglutinin. So you're looking at lectins, and lectins go into the stomach and they cause upset because the seed does not want to be eaten. So what happens is these lectins are released into the body, and that causes you to have a hastened bowel movement. So the seed doesn't get broken down into hydrochloric acid, and it passes through the body and out the feces to then be germinated and to grow more wheat. So it's actually quite ingenious, and plants' defenses against people and things that eat them are unbelievable. And they're not even showing on here that since this is a hybridized form of wheat, they're not even showing us that, oh, you can have problems with the spray that they put on there that's called glyphosate, because glyphosate will break down. Glyphosate's an antibiotic. It kills your gut bugs and it shreds the stomach. So you get a twofer there. I think unless people have a lot of questions and I see something up here that I really need to, oh, this might be useful to y'all. So gluten containing and non-gluten. So with Cyrex, when we do go with them and we do test with them, let me pull this up. They test cross-reactivity with foods. So if you're drinking coffee and you're seeing stuff that, these are things that can potentiate the effect of gluten. And then you're seeing gluten and non-gluten containing foods or gluten contaminated. And look at that, instant coffee. So we use a French press. We grind our beans. We love them. When we look down there, you see all kinds of things that we look at that oats. I mean, if you're going to eat oats, make sure you get the gluten-free variety. I like the Bob's Red Mill. And you can do Bob's Red Mill, Steel Cut, and those are supposed to be gluten-free. You look for the gluten-free label. So gluten-free, Bob's Red Mill, Steel Cut oats, those are oats you can have. And then you look at overconsumed foods: buckwheat, sorghum, hemp, sesame, amaranth, quinoa, tapioca, teff, potato. So these things are things that aren't necessarily going to cause a gluten reaction, but because you eat so much of them, they do cause an issue because they do still contain lectins. And then raw eggs and soy. Unless I see something popping up in the side screen over there, I am going to take one more moment here and go through a couple more slides and see if they are of any consequence. Uh-oh. I hate it when I move slides around. Let's see how I do this. Let's go over here. Now, let's go here. So I think that's about it. They're showing a slide here that shows multiple food immunity reactivities because they can test for that. I will pop up over here now. So I think that's a good place to actually start to wrap this up. Know that your environmental toxins are your stuff like your cadmiums, your mercuries, your aluminums, your PCBs, if you're drinking out of cans, they line those with bisphenol A. Your BPA binding proteins get activated then. So when you see all of this stuff, when I hear all this, it just makes my head spin. And when I heard it the first time, I was like, good Lord, what can I eat? Where can I go to eat? And it makes it very simple. You can go eat at your kitchen with food that you prepare or have prepared. And that's what you need to do. Eat simply, resource your own foods so that you know what is in them. Learn to cook. That's the best way. Our elimination diet is actually a breeze for us because we cook at home and we've already shopped the way that we need to shop. So it's all there. All it takes is a little prep work. And as you do the prep work, then you start to eliminate what I call the noise. And as you eliminate the noise, you can slowly but surely come in and get to feeling better. We have another functional medicine patient that came in on last Thursday, a week ago today, had 4+ pitting edema. We started her on her food plan with her nutraceuticals, and she came in on what day did she come back in on that you saw her and you retested her pitting edema?
Tuesday.
What was that?
Tuesday, no swelling, no stomach pain, could actually sit through a meeting without having to get up. Actually feeling fabulous.
And so those are the things and she prepares all well. Unfortunately, she had a spouse die who was immunocompromised. And so she had to follow a very strict and stringent diet. And when he passed away, those were relieved. She didn't have to do those anymore. And so she actually started going back to more convenience foods. We still think there's some underlying stuff. We're going to get another blood test, hopefully tomorrow. Me just saying that's probably making Jessica sweat.
Yeah.
I popped up on the screen. You can see down here where that's our YouTube channel. So if you go into the chat, you highlight, cut, and paste that into your internet browser, you will see all 50+ videos. We're adding more every week. And also, feel free to send me a question. And there is my email once again. With that said, we've taken 38 minutes of your time. I appreciate your taking this time to work on yourself. And hopefully you are learning stuff to take control of your health and be happier and healthier because of it. Have a wonderful day.
See you later,
Bye.
guys.
Oh, now I got to figure out how to turn it off again. I'll edit that out. Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor-patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in-person and virtual consultations. Thank you.